there's something called pre-implantation genetic testing for aneuploidy, and that is a time where you can test before you're pregnant. There's also ways to test after you're pregnant, but because I am a fertility specialist, I mostly counsel patients on deciding whether or not they want to do PGTA, pre-implantation genetic testing for aneuploidy. And that is basically when you go through an IVF or in vitro fertilization cycle, you create embryos, and then when those embryos have reached a certain stage of development, we can biopsy a small portion of the cells that make up that embryo, about 5 cells. We freeze that biopsy, we freeze the embryo, and then the biopsy gets tested for its genetic content. Usually, all of the cells in that embryo will have the same genetic content because they came from one sperm and one egg. So taking a sample of those cells and testing it can let you know if there are 23 chromosomes and if there's 2 copies of each. It can also, if you want to know, tell you the sex chromosomes because we have to look at the X's and the Y's as well. And that is a way that patients and physicians like myself help determine which embryos we are going to return to the uterus for a potential pregnancy. The embryos that come back as either trisomy or monosomy or having some chromosomal abnormality, we almost always choose not to use. So that's testing before you're pregnant, and that's used very commonly now in vitro fertilization and in fertility clinics. You don't have to test your embryos for their genetics. It's just an added piece of information.